All right, another episode of reading. We are on phmpt.org, which is Public Health and Medical Professionals for Transparency documents. These are Pfizer's documents. We are in the document 5.3.6 post-marketing experience.pdf. In that PDF, we are on page 30, Appendix 1, List of Adverse Events of Special Interest. The one we are on is acute macular outer retinopathy. Acute macular outer retinopathy. What was I saying? Retinopathy? I might be saying that word. So we're just defining words. That's all we're doing. Don't pay attention to that one. That's the last video. We are on. Okay, I guess we have to do acute macular outer retinopathy. Alright, just defining words. Okay, pubmed.ncbi.nlm.nih.gov. Just trying to stick to the general source here. So I try to do these just try to let you see me do the initial research if I can. A couple of them at the beginning didn't work. And every once in a while you run into a situation where the definition isn't the first thing they give you. You get a bunch of articles. I just want to check this out. This first one says bilateral, paracentral, acute middle maculopathy, and acute macular neuroretinopathy following COVID-19 vaccination. I'm just going to read it. This isn't meant to be advice or anything. Alright, so we have an abstract from the bilateral, paracentral, acute middle maculopathy, and acute macular neuroretinopathy following COVID-19 vaccination. Here's the abstract. 35-year-old male patient presented with blurring and black spots in vision after 1 month of the second dose of Covishield vaccination. His visual acuity was 6 of 6. Both eyes and anterior and posterior segment examinations were normal. The optical coherence tomography showed multiple hyperreflective lesions involving the nerve fiber layer with backshadowing. In addition, there were hyperreflective spots in the ganglion cell layer and outer plexiform layer with focal loss of external limiting membrane and an intact inner segment/outer segment junction involving the posterior pole in both eyes. The patient was diagnosed with paracentral acute middle maculopathy and acute macular neuroretinopathy and advised observation. PAMM and AMN are unreported manifestations following the COVID-19 vaccination. I just wanted to define it, but that's an abstract from a case called bilateral paracentral acute middle maculopathy and acute macular neuroretinopathy following COVID-19 vaccination from pubmed.ncbi.nlm.nih.gov /3457165 Right, but that's not a definition, so we're not done. So retinopathy. It does sound like they're talking about your eyes, though. Alright, well, so we just read the abstract from one about, wasn't quite the same word, so we just want to make sure that we're being accurate. One we're trying to do is acute macular outer retinopathy. There's a few, but what we did was we went to the first one and it was just, then we followed this one, which is talking about middle maculopathy. So we're looking for outer. The one we just read was about middle. So it seems like we might get to that one later. So let's try to find just some basic definitions. Macular is relating to the macula, the area around the area of the retina responsible for detailed central vision. Outer retinopathy. You come to nih.gov. This one I will read. We have a summary for, they use different words again. This one is acute zonal occult outer retinopathy. We're going to read that one. Again, on their list, it says acute macular outer retinopathy. This one is called acute zonal occult outer retinopathy, or AZUR. Is a rare condition that affects the eyes. People with this condition may experience a sudden onset of photopsia, the presence of perceived flashes of light, in an area of partial vision loss, a blind spot. Other symptoms may include whitening of vision or blurred vision. Although anyone can be affected, the condition is most commonly diagnosed in young women, average age 36.7 years. The underlying cause of AZUR is currently unknown. However, some researchers have proposed that infectious agents, such as viruses or autoimmunity, may play a role in the development of the condition. No treatment has been proven to improve the visual outcome of AZUR. However, systemic corticosteroids are the most commonly used therapy. And that is the summary of acute zonal occult outer retinopathy. What we're looking for is acute macular outer retinopathy. So I did find one. This is from the JAMA Network, which is ophthalmology. This is jamanetwork.com. See if I can get you, in case you can't see it. Acute macular outer retinopathy, or AMOR. A reappraisal of acute macular neuroretinopathy using multimodality diagnostic testing. We're just going to read the first paragraph. Acute macular neuroretinopathy, or AMNR, is a rare retinal condition that features the sudden onset of bilateral central scotomata, which may be preceded by a viral prodrome in some patients. Acute macular neuroretinopathy may be difficult to diagnose because of the subtle or even absent findings of fundoscopic examination and fluorescein angiography. Bose and Dutman initially described AMNR in 4 patients with paracentral scotomata, slightly decreased visual acuity, and reddish wedge-shaped intraretinal lesions directed toward the fovea. Because of the acute onset of the symptoms, and based on their theory that the more superficial layers of macular retina were involved, the term AMNR was adopted. We're just reading, this one is the term, acute macular outer retinopathy, from the list of adverse events of special interest. Alright, that video is done.